This is just our initial discussion around trauma and trauma-informed care. We'll be spending more time on this in an upcoming module when we'll have some guests from the First Nations community who have things to say about historical trauma and about experiences and interactions with first responders. We'll be looking both at residential school or First Nations historical traumas briefly here, as well as that from some other groups that you might not first think of. We're going to begin with a quote from a Stolo elder who's only identified by his initials, AC, in Gordon Moses' Spiritual Sites, Ethnic Significance, and Native Spirituality, the Heritage and Heritage Sites of the Stolo Indians of British Columbia. And in it he says, he finds this quote, "We have a very powerful spiritual life. Without our spiritual ways, we get into trouble. Our language is our religion. It was given to us by the Great Spirit. We can't live without it. Once Coqualitza first opened up, they took our kids and tied them to wagon wheels and whipped them if they spoke Indian. We have managed to survive in spite of all of this. We got to get hurt from the Great Spirit once in a while. It's a test. It's important to identify Indian spirituality for ourselves." Now, Coqualitza was just one of the many residential schools that was opened across British Columbia, and many of them operated for approximately 100 years. And within those schools, there was both sanctioned and unsanctioned things that happened that were traumatic for people in the First Nations community. The sanctioned things that happened were, for example, of course, that children were removed from their families and communities of origin, often without any choice. And when they got out of those communities, they were often told that they could not speak their language or practice the cultural and valued traditions that were often connected to their spirituality. And it's important for us to note that the people who did that believed that they were doing good by the people that were in their institutions. And this is a truism that I think transcends not just the First Nations residential school experience, but almost any institution that we could look at historically. It was St. Bernard who said, and it was later quoted by a couple of different popular singers, that the road to hell is paved with good intentions. And in fact, we need to remember that. Much has been done through history that has created tremendous harm from others by people who believed that they were doing the good and righteous work. And it's important for us to not necessarily assume that good intentions always have good results. So there were also unsanctioned things that happened within the walls of these residential schools. Chronic physical and sexual abuse. One could argue that in some ways neglect was a part of what was going on there, as well as children were sometimes punished by not being allowed to have food or by not having adequate clothing, often simply because these particular schools may not have had the funding or resources that they should have had. So that's just some of the stuff that happened to people of First Nations histories, and these were closed as recently as the 1980s here in the Mission area. So there are certainly people who are alive in our community who have been directly affected by residential schools, and many, many more who are a generation or two after the residential schools who would still have those downstream effects. No matter which cultural group we're speaking of, the effects of this historical trauma have been lasting, but in no group has it been more prominent than in the First Nations community. Because when we have these historical traumas that transcend not just one, but in some cases multiple generations, we create a rudderless society. The group loses its culture and many of its significant others. In particular, the First Nations community lost a connection to many of their elders. Young people, traditionally in First Nations communities, often get a considerable amount of their guidance through the elders, and they often learn about their history through a verbal communication that is passed down in a timely and careful fashion by elders. And so this was essentially lost. When you think about what we get from our culture, it gives us a great deal of direction in terms of how we should manage social phenomena, things like poverty or crisis or mental health. And when we lose that, we are more likely to be prone to poor coping with those social trauma. We have to learn everything over again, and we lose the generational knowledge that is so important to us. But we also develop low social esteem. And as we said, who we see ourselves as and how we value ourselves, our self-esteem and our identity, are connected very closely to our social esteem. So It would have been a valid thing for a person of First Nations heritage or anybody living in an institutionalized setting to say that being locked away from the rest of the community was emblematic of their low value. They would have correctly read the social fabric as saying they didn't matter very much in society. And other people would certainly have seen that as a signal as well. Stereotypes about people from these groups would have been easily advanced because nobody would have been out in the community demonstrating anything contrary to those stereotypes. What the end product of this is cyclic social issues. We see them happening generation after generation, such as poverty and addiction, because the parents that need to come in and be such a strong role model, strong intervener, strong supporter in those interactions have themselves been victims of the very same trauma, and it's passed on from one generation to the next. And when you think about it, in some communities, the high propensity of these things, poverty and addiction, made it far less likely that a sufferer would be able to find sort of an island in the middle of the stream or a port in the storm, because many of the other people in the community were going through the exact same trauma and would not have been available as resources or as models of another way of managing. Additionally, many of these communities began to become socialized both at the time and in subsequent generations to distrust authority. So it was taught intergenerationally. Even for young people who've never lived in an institution, these are social experiences that are very fresh in the mind of the community and are talked about very, very frequently. People became highly sensitive to anything that even slightly resembles institutionalization. So that's why we were talking earlier about the artifactual attribution of things like keys and uniforms, being told that one has to fill in forms, for example, or go to an office. Often these things may not seem as significant to us as they might, for example, from a cultural or social group that has gone through historical trauma. To us, going and sitting in an office is just day-to-day business. But for others, they may be highly sensitized to that same setting and may see it as the first steps or indicators that they're about to have their rights trampled upon or their independence taken away. And in many cases, people became acclimatized to unhealthy lifestyles. Without social models, without exemplars around them of how to live an alternative and more healthy approach, it becomes oddly quite accepted within a community that a person is going to live through a certain amount of social discord, of things that most of us would find unacceptable. So people oddly have become somewhat tolerant of things like spousal abuse or a suicide in their community. They begin to become somewhat inured or numb to these things because they don't have other points of reference. And so for many people, this idea of being removed from their community is still going on because they live in neighborhoods that don't have strong connections often to the greater part of the world. And often they are going through the exact same social hardships as people have gone through for the generations before them, and they just accept them as the way things are. So we need to think beyond an institutional approach when we support people, and we need to do that as an active and deliberate behavior, even though we might think we're long past the days of locking people into large sort of faceless buildings. The truth is that institutions were not about the buildings, the keys, and the locks. They were about a way of thinking, about creating systems that treated all people as though they were one individual and that one size would fit all. And it also spoke greatly to the idea that we would see the differences between us much more than we would see the commonalities. We need to realize that localized care is vital. Being connected to the individual culture of a neighborhood or of a smaller social group is much more impacting than understanding about the entire, for example, Indo-Canadian community or all of Mission. Understanding what resources work even from neighbor to neighbor, who's there to support people, and how do local agencies tap into that community value system really is an important part of why it's better for us to have small agencies that are located within a community than larger agencies that gather people in a central location. So we have to have a knowledge also of local traditions and history. For example, here in Mission, it's important to understand what is meant by Stolo culture. And this is one of the reasons why we'll have people on a panel in a few days. But it's also important for us to look at it on our own. And I would really strongly encourage people, for example, to go out and learn the history of Hatem Rock, because I think it's a very healthy tradition. It speaks to why Mission is a setting where, for First Nations people, education and learning was identified as this being, Mission was identified as a site for that to happen. That's a very healthy tradition, and we want to make sure that we give respect to that idea and build on those positive traditions instead of always focusing on things that are negative. We need to really focus on relationship. And I'm talking about micro relationships. Is it important for Mission Fire and Rescue or the RCMP to have a connection, for example, to Chehalis or to Lakahaman? Of course it's important, but it's never more important than when an individual first responder has a connection to an individual person or their family. And building that trust one person at a time is how we may gradually evolve past some of the impacts of historical trauma. The interaction with the person's family, as I started to allude to a moment ago, is critical, and it's especially important in certain cultural groups. Understanding that for a person with chronic mental health needs or a long-standing addiction or developmental disability probably means that individual has interacted with many, many professionals, sometimes thousands over the course of their life. But the one person or group of people who's been there from the beginning and sort of can thread the whole story together is the family. And sometimes there are other people within the community who have had long-standing connections as well. So valuing what they have to say and what they can do to help maintain wellness is very important. We are often too reliant on formal supports when informal supports and informal sources of information may be far more valuable to us. We need to be proactive interveners. If we only see people when they're in crisis, there are at least 3 problems. First, our picture of that person will be highly lacking in being accurate representation of them. We know that when people are in crisis, they're at their worst. They are not typically demonstrating their assets at that time. Second of all, we'll start to burn out. We'll start to think of that interaction as being typical of all people with mental health needs or other crisis situations, and it'll be easy for us to understand why we might start to lose faith in other people. And third of all, we simply won't make a difference for people because we'll only be there at the times when there is the least learning and communication possible. We won't know what to do because we haven't had a conversation with that individual or their family in advance and really be able to tailor or individualize supports that will work for them at that time. So we'll constantly be fighting that uphill battle. Proactive interactions will help us to build relationships, will teach us individualized ways to support that individual, and will allow us to monitor that person so that we can see things that are indicators of possible crisis long before they occur. And if you're thinking to yourself, I don't have the time to go and interact with people on a non-crisis basis, ask yourself how time-consuming it is to interact with them on an only crisis-based basis. If you only do it then, chances are you're being extremely tied up by people at times when you cannot plan, and you're probably getting very little productivity out of your time. We want to have a mutual client-centered approach to planning. In other words, get that individual to play a key role in telling you what they want and what's going to work best. They're far more likely to subscribe to whatever interventions are going to occur. When you show up and ask them to take those steps, you're going to have to do less work to establish trust and defeat defensiveness, and you're just simply likely to pick the approaches that that individual knows will probably work better for them. Now, we're going to wrap up, and what I'm going to do is ask you to do a little bit of homework, because there's no single better way for us to find out about services in Mission than going out and making a contact, establishing a relationship of another kind. So whatever you do, make a contact with somebody who does something different than you, but might be somebody who presents a potential resource. So we're going to ask you to be in contact with services in Mission, such as Fraser Health Authority, particularly the mental health services, Mission Community Services Society, Fraser House, Mission Friendship Center, Women's Resource Society of the Fraser Valley, Mission Public Schools, the Union Gospel or Lydia House, and Communitas, which operates Centennial Clubhouse in Mission. And what I want you to do with each of those service providers, or if there's somebody else that's not on that list that you can think of to contact, and there certainly are plenty, for each of those service providers, find out the following and post it on the blog. What's their location? Even some of these agencies have head offices, for example, in Abbotsford, but they have locations here in Mission. What services do they offer and for which populations? What's their philosophy of care? And I've emboldened this because understanding the philosophy of care of an agency helps us to know whether or not to call that particular group of people at a particular time, and avoids us having what I call philosophical conflicts with people. If we are approaching things from different models, policing, for example, versus community service agency, that can work very well as long as we both understand what we are able to do and what we're not able to do, and how we are trying to help. What population is served, as I've said. What's the process for a person getting referred to that agency? Can they self-refer? Can they walk in or drop in? Or do they need to go through another professional, such as a teacher, a psychiatrist, a doctor, or a social worker? Are there any costs or prerequisites? For example, is there an application process? Does the person have to go through detoxification before they can get that recovery service? Just as a couple of examples. And think about hidden costs as well, such as whether or not a person might have to take a bus trip or get a taxi to access that particular location. And with that, we're completed the lecture portion of Module 2. What's left for you to do in order to earn your certificate is two things. First, complete this contact and make your entry on the blog. Find the contact information through your telephone book or through the web, and then make your contact either in person or by telephone. Email is an okay choice, but we prefer to see you making a personal connection with an agency service provider. Sometimes I'm asked, are people going to be okay with us making a contact? And the answer is, if they know that there's going to be a better connection between your community service agency and theirs, you can bet your bottom dollar they're going to be happy to talk to you. That's part of what they're spending dollars every day to try and make people understand. So when you call them and ask, that's a great way for them to use their time. Take about 5 to 10 minutes in that conversation, and if you have the opportunity to share information about your organization, then that mutual process will be even more constructive. So answer these questions on the blog entry. And then when you're done that, the very last step is to complete the post-assessment. And again, as with all of our assessments, the questions that you'll hear and see are the same as the ones that were in the pre-assessment, with 2 questions added. And those 2 questions, again, ask you to identify what you've learned that has been of most value, and also to consider how you might change your practice based on what you've learned here. And for those, we really want to ask you to take your time to think about those in all seriousness, because the quality of those answers will give us a great deal of information about how we can mold this course to fit better. Thank you so much for your time, and we look forward to seeing you in Module 3.